This is the importance of cervical cancer vaccine HPV. Cervical cancer is one of the scary diseases. One way to reduce the risk of getting the disease is to provide cervical cancer vaccine. Cervical cancer is mostly caused by sexually transmitted virus, that is human papillomavirus HPV. Cervical cancer vaccine is one effort to prevent transmission of the virus. HPV infection in women can cause abnormal growth of cells in the cervix. In some women, the disorder can then develop into cervical cancer. For women, cervical cancer vaccine is recommended 3 doses in 3 times. The first vaccine given in adolescence is 11 to 12 years. Then the second vaccine given 1 or 2 months after the first vaccine. Then, the third vaccine was given 6 months after the first vaccine. The third dose of the vaccine is believed to be a long-term protection against HPV infection. If the adolescent dose of vaccine is not yet complete, it is better to consult a doctor to complete the dose of the vaccine. Not only women, men can benefit from HPV vaccine. For men, HPV virus can also cause genital warts, anal cancer and throat cancer. Apart from cervical cancer, the recommended male group for HPV vaccine is men who have sex with men or who have immune disorders and are 26 years or younger. Types of vaccines. HPV viruses have various types. About 40% of all HPV types can cause infection in the genital areas. In addition, certain types can trigger cervical cancer. Here are some types of HPV vaccine that can now be used, namely: 1. The first type is cervix. Commonly used to prevent cervical cancer and pre-vaccine. This type of vaccine will prevent HPV-16 and HPV-18 infection that are commonly used as a cause of cancer. HPV vaccine is intended for women only. 2. The second type is Gardasil, used to prevent cancer and pre-cancer of the cervix, vulva, vagina and anus. In addition to preventing infection caused by HPV-16, HPV-18, also ward off HPV-6 and HPV-11 infections as the cause of genital warts. For men, the use of this vaccine can be done at the age of 9 to 26 years. 3. The last type of Gardasil 9. The prevention coverage of HPV infection from the vaccine is wider than previous Gardasil, which includes HPV-31, HPV-33, HPV-45, HPV-52, and HPV-58 are closely linked as causes of cervical cancer. For males, Gardasil 9 can be used for ages 9 to 15 years. Side effects. Adverse effects of HPV vaccination generally occur temporarily and are relatively mild. Some of the effects are often complained of, such as swelling, pain and redness around the site of injections and headaches. In addition, side effects are not too often found in the form of fever, nausea and pain around the arms, hands or feet until the emergence of an itchy red rash. Then, there are also very rare effects of respiratory tract obstruction and difficulty breathing. Although somewhat rare, HPV vaccine is also likely to trigger a severe allergic reaction known as anaphylaxis allergy that threatens the safety of the soul. Consult your doctor before you decide to get a cervical cancer vaccine. Request complete information to make the right consideration of the benefits to be gained and the risks of side effects.
Like and subscribe, 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 like and subscribe.